So MEPSGEN is a biotech company that develops microphysiological systems, also known as organ-on-a-chip technology, that allows accurate prediction of drug efficacy and toxicity under physiological level microenvironment. We are using those technologies to develop our nanomedicines for rapid translation in the market. So we also develop micro-vortex technology that can actually manufacture lipid nanoparticles that can encapsulate messenger RNA for higher encapsulation efficiency. So like corona vaccines, we know lipid nanoparticle manufacturing was a challenge, a barrier. So we are developing those microfluid modules to mass produce lipid nanoparticles with uniform size distribution. So I was the engineer. I'm still engineer, but I was like traditionally mechanical engineer. Now I'm bioengineer. So I worked in Hyundai Motor Company and Gear Motors and Samsung Electronics for 7 years, working on improvement of mechanical electrical systems. And one day I thought like I want to do something more helpful for people with high impact, and I applied for bioengineering schools and work on the embryonic tissue development microenvironment, working on how they can actually cells are working together. And then that was the chance with which I can meet Dr. 랭거'의 at MIT when I learned about how people develop drugs. We are targeting brain disease, including Alzheimer's and brain tumors. The reason we are targeting brain disease because our nanoparticle has a ligand to bind the receptors in the blood-brain barrier, in the vasculature in the brain. And we tested a couple of times how we can target the brain tissues better with the nanoparticles. And now, first pipeline we have targeting Alzheimer's has very good performance for clearing amyloid, and the competitiveness of that nanomedicine compared to the antibody approaches. And we don't have actually the side effect known. So because we are using human-specific proteins we have in our body and creating nanoparticle, making that stable enough to traverse across the blood-brain barrier. So we actually get really good data for the efficacy and toxicity in rodent models. And we are moving on for non-human primate liver toxicity, which was actually requested by a couple of pharmaceutical companies when I had a meeting with them in San Diego last year with Bio. So if we get really good minimal level of toxicity using monkeys, and we may have a good chance to transfer, I think, next year. So usually people test their drugs and nanoparticles using animal models and screen those drugs, which one is better. But actually it's very hard to test and quantify how much they can actually get in the brain compared to the plasma. So people usually get the blood from animals and see whether brain plasma ratio to see how much they can actually get inside. Taking images or sampling. And what we can do with our BBB on the chip model, we can actually test the mechanisms, how they can actually get into the brain with multiple time points, with different dosages, more efficiently. So actually we can test those receptors supposed to target is the one we are actually targeting, or there's another ways we can get to the brain, which is pretty challenging and difficult in using animal models. We are also developing liver model and kidney model, and one of the challenges in this field is still people and researchers, they feel this is hard to do, and because they have their own conventional approaches in testing drugs, and replacing what they have done is a challenge, and no one really want to do that because they don't want to take a certain burden. So we are actually making cryopreserved model, so they don't actually have to culture cells. They can just incubate like frozen food when they microwave them. So they can actually incubate them and test drugs right away without cell culture. And another equipment we are developing, we are going to launch later fall this year, say October, the equipment will actually build all the models automatically. There's a robot system inside, so people actually users don't have to do anything but wait for the model, and once they get the model after 24 hours, 48 hours, because it's fully automatic incubation system. So they can get the model and test the drug by themselves, whatever they want, whether they sample drugs or they treat some of those with different environment. They can actually play with those in high throughput fashion. So because the equipment will provide 32 units at a time, so they can actually do without cell culture risk. When I got PhD 2011, I had an interview with him, which was just 7 minutes, and I was 3 minutes late, so I realized I have just 4 minutes to talk to him, something about me. So I had a chance to meet him, and he didn't actually look at me when I had the interview with him. He actually worked on his own iPad and replying all the emails he's receiving every minute. So I talked to him who I am and what type of idea I had, and that was it. 4 minutes, not much time. And I got out. I didn't think I passed it, and he emailed in the same night that some of the ideas I proposed, he said the second one was good to go. So I didn't know what that means, and later I realized that that's what he said. You can join my lab, and the secretaries actually send all the documentation what you can do to join the 랭거 lab. One thing I remember, interesting episode with him, like I mentioned, like he's actually not looking at who he's meeting. So like, because he has to do like checking emails, like because he cannot leave his email rolling, because all those emails will be ignored if he didn't really pay attention to. So he's working with his email. He's still listening what his the people who's meeting with him telling to him. So I was in the same way, and I was used to, because even though you are not looking at me, I know you are listening, so I'm telling you. That's the way of the meeting, as a training. But that one thing was very impressive. I was impressed is when I got a job in Georgia Tech, and now I became professor, and he didn't look at the iPad and leave everything and making eye contact, and we chat about like 3 to 4 minutes, and the topic was what type of research I should do when I started Georgia Tech, and he suggested, what about doing blood-brain barrier, because that's a challenging one. No one actually successfully made it yet. And so 6 years later, when I published a paper, I actually emailed him, like, this is the paper, and we talked about, and I made it. So our relationship is like that, like not only like former mentor, but she's like friend, very nice, generous, helping me in tons of ways. Like, as I'm professor, before I start the CEO job here, I have a habit, I have a commitment to help people and mentor them and advise them, rather than ask them to do as hard as possible for the company. And I thought that that's maybe not ideal as a CEO, because I'm not an educator here. I should do something as a CEO. But that was what I did for 10 years. It's hard to get those habits out of my. So what I think is, I can do some of those things as long as my employees like it. And what I can do is let them play in a comfortable environment, and also supporting them whatever they want to do within a certain funding the regulation restrict. I believe that's the way they can actually become creative, and that way we can actually move forward in the right direction in a more efficient way. I'm looking at what we are doing is the right direction in terms of more effective or efficient drug development. And so in 10 years, I think we grow very fast and becoming top tiers in worldwide in this field, taking 20 or 30% of the market. and our nanomedicines in the pipelines, in the clinical trials, working with some pharmaceutical companies and together in the clinical trials.